Catalina Escobar, and today I'm going to be demonstrating some elbow stretches and exercises that we can incorporate in the rehabilitation protocol of patients that complain of elbow pain or have any associated conditions with the elbow. The first thing that we're going to do is we're going to do two different stretches. The first stretch is going to be, we're going to be stretching the wrist extensor muscles. So the wrist extensor muscles are going to be the ones in the back of the forearm. Remember that these muscles originate from the lateral epicondyle. So this stretch is very useful when we're treating patients that have lateral epicondylopathy. So for this stretch, we're going to tell the patient that bring the shoulder to a 90-degree angle, have the elbow straight, and have the forearm pronated. Then we're going to tell them to actively ulnar deviate and then flex the wrist and flex the fingers. Okay, now they're going to hold the stretch for 15 to 30 seconds and they're going to feel the stretch right here. Remember, that's important to tell them that there should be no pain, just a very light stretch. Okay, now they can also take the other hand and add a little bit of extra stretch to this stretch so they can feel a little bit more. So they're gonna add a little bit of pressure and take that wrist more into flexion. We're gonna hold it for 15 to 30 seconds, no pain, just a light stretch. Now, another idea is that it's recommended not only to do with the elbow extended, but also with the elbow flex, because we're gonna target different muscles. Now they can also do it against the wall, so they can use the wall and then just lean and feel the stretch right here. Now the second stretch is a stretch, but this time it's going to be for the flexor muscles. So the flexor muscles originate from the medial epicondyle. So this stretch is very useful or helpful when we're treating patients with medial epicondylopathies. So for this stretch, we're going to tell the patient to bring the shoulder at a 90-degree angle, have the elbow straight, and the forearm is going to be supinated. Then we're going to tell them to actively radial deviate, extend the wrist, and extend the fingers. And then they're going to hold the stretch right there. They're going to hold it for 15 to 30 seconds, and they're going to feel it right here. Remember, it's important to tell them that there should be no pain, just a light stretch. Now, to add a little bit of extra stretch, they can take the other hand and gently apply some light pressure to increase that extension of the wrist as well as the fingers. Now they can also, it's recommended to also doing it with the elbow bend. So they're gonna be right here, radial deviate, extend the wrist and extend the fingers, and then add a little bit of extra pressure to increase that extension of the wrist and feel the stretch right here. Now they can also use the wall and lean against it, feeling the stretch right here. Now we're gonna move on to do some elbow exercises. So we're gonna start with isometric exercises first. So for this exercise, we're gonna do flexion and then we're also gonna do extension. So to do flexion, we're gonna have the forearm in 3 different positions. The first one is gonna be with the palm up, and this one is gonna target the biceps brachii muscle. We're gonna try to have the muscle in the most shortened position, so right here, and you're gonna tell the patient to take the opposite hand and add gentle resistance while the affected arm is performing the muscle contraction. So it's gonna be here, and then we're gonna oppose and add resistance. And remember that isometric exercises are held for 6 to 10 seconds. Okay, now if the patient has the hand palm down, then we're gonna do the same thing, but now we're gonna be targeting the brachialis muscle. If the thumb is pointing up, then we're gonna do the same thing, but we're gonna be targeting the brachioradialis muscle. So everything is dependent on what we're doing with the forearm. Now we can progress this by doing each position in 5 to 7 different angles. So remember, we start in the most shortened position, and then we can progress by doing it on this angle, then this angle, this angle, this angle, but the same thing. We're opposing the resistance that the opposite hand is doing. Now we can also do this with extension. So it will be the same thing, but instead of having the opposite hand right here, we're gonna have it here, and we're just gonna try to extend the elbow. So same thing, Hold it for 6 to 10 seconds. And remember that because it's an exercise, we want to tell the patient to brace and breathe at all times. So I'm going to demonstrate it again. So this will be isometric exercise for elbow extension. Hold for 6 to 10 seconds and brace and breathe. Next is isometric exercises for the wrist. So we're gonna do isometric exercise for flexion, extension, radial deviation, and ulnar deviation. So we're gonna start with flexion. So to do flexion, we're gonna tell the patient to place their arm either on a table or on their thigh, and they're gonna have their elbow bent at a 90 degree angle, and they're gonna have their wrist, they're gonna have the palm facing up. So the palm is gonna be facing down, up, and you're gonna tell the patient to have the wrist at the most shortened position to start. So what that means is they're gonna have the wrist completely flexed. Now you're gonna tell the patient to take the opposite hand and add gentle resistance while the affected arm is performing the muscle action. So we're gonna resist this motion. We're gonna hold it for 6 to 10 seconds, or we're gonna tell them to brace and breathe at all times. They can progress this by doing it at different angles, so about 4 to 5 different angles. So they start always at the most shortened position, but they can progress to here, do the same thing here, same thing. Now, they can also, whenever they have accomplished full range, they can progress by doing it with the elbow straight. So it will be the same thing, but the elbow is gonna be straight. The wrist is gonna be in the most shortened position, and we're gonna use this hand to resist this motion, the wrist flexion. Now to do extension, it's gonna be the same thing. The elbow is gonna be bent at a 90-degree angle. Now the palm is gonna be facing down this time, and they're gonna have the wrist at the most shortened position. So it's gonna be all the way extended as much as they can. Now you're gonna tell the patient to take the opposite hand and add gentle resistance while the affected arm is performing the muscle action. They're gonna hold it for 6 to 10 seconds, and we'll remember to tell them to brace and breathe. Right here, and we're opposing the motion. Now they can progress this by doing it at different angles, 4 to 5 different angles. So they start at the most shortened position, and then they do it at 4 to 5 different angles. And they can also do this one whenever the full range has been accomplished. They can do it with the elbow extended. So elbow extend, most shortened position, so as much as they can extend the wrist, and then apply gentle resistance with the other hand. Now to do radial and ulnar deviation, it's gonna be the same. They're gonna have the elbow bent at a 90-degree angle. They can do it here, or they can also use the table, but we're gonna do it on the thigh. So the elbow at a 90-degree angle, and to do radial deviation, they can either have the palm facing up or the thumb pointing up. So I'm gonna do it with my thumb pointing up. They're gonna have the muscle. They're gonna have the wrist at the most shortened position to start. So you're gonna tell them to completely radial deviate the wrist. And then you're gonna tell them to use the opposite hand and add gentle resistance while the affected arm is performing the muscle action. So right here, and then we're adding the gentle resistance. They're gonna hold it for 6 to 10 seconds, and remember to tell them to brace and breathe. Now they can progress this by doing it at different angles, so about 2 more different angles than the starting position. So they start here, but they can also do it here, and then maybe right here. To do ulnar deviation, they're gonna have the elbow at a 90-degree angle, and they're gonna have the palm down. So you're gonna tell them palm down. Now you want the muscle in the most shortened position, so they're gonna completely ulnar deviate the wrist. And now you're gonna tell them to take the opposite hand and add gentle resistance while the affected arm is performing the muscle action. So we're gonna apply their gentle resistance with this one. We're gonna tell them that they're gonna hold it for 6 to 10 seconds while they're bracing and breathing. And then they can relax, and they're also gonna progress this by doing it at 2 different angles. Next is resistance, concentric and eccentric exercises for the wrist with a hand weight. Because I don't have a real hand weight, I'm gonna be using this and we're gonna pretend that this is a hand weight. So first we're gonna do the concentric and eccentric exercise for ulnar deviation, and then we're gonna do it for radial deviation. So for ulnar deviation, we're gonna tell the patient to stand with the arm, with the elbow straight and the arm by the side. Now you're gonna tell them to take the hand weight towards the pinky side. So the weight is gonna go out towards the back, and you're gonna tell them to brace and breathe and to bend the wrist up. So just like this. And then you're gonna tell them to slowly lower the weight down. And then they're gonna do it again, so the wrist goes up, and then it's gonna go down slow and controlled. So when the patient is bringing the wrist up like this will be the concentric phase for ulnar deviation, and when they're lowering down, that will be the eccentric phase. Now, if you only want the patient to do the eccentric contraction of the ulnar deviator muscles, then you're gonna tell the patient to take the opposite hand and lift the weight up and place that wrist in full ulnar deviation, and then let go and tell the patient to only perform the lowering phase. So again, lift the weight up with the opposite hand, and then just tell them to perform the lowering phase. That would only be doing the eccentric phase of the ulnar deviators. Now, we want to do radial deviation. We're going to tell the patient to sit and place their arm on a table with the hand off the table. Now you're going to tell the patient to grab the hand weight, and they're going to grab it to one side, and it's going to go out towards the thumb side. So just like this. They can either do it with the palm facing down or the thumb pointing up. So in this case, I'm going to do it with the thumb pointing up. So you're going to tell them to brace and breathe, and you're going to tell them to bring the wrist up and then lower the hand weight slow and control, bracing and breathing. So go up and then slow and control and in the way down. So when they're going up, that will be the concentric phase for the radial deviators, and when they're lowering the weight down, that will be the eccentric phase. If you only want your patient to do the eccentric contraction of the muscles that do radial deviation, you're gonna tell them to take the opposite hand, lift that weight and place the wrist in full radial deviation, and just tell the patient to only perform the lowering phase. Again, take the opposite hand, bring that wrist up to full radial deviation, and tell the patient to only perform the lowering phase. That would be just to target the eccentric contraction of those muscles that do radial deviation. Next, we're gonna do eccentric exercises for the forearm using a hand weight. So this is gonna be our hand weight again. So we're gonna do eccentric exercises for flexion, extension, supination, and pronation. So we're gonna do flexion first. So for flexion and extension, we're gonna have a grip in the middle. We're gonna have the grip in the middle of the hand weight. So for flexion, remember we're telling the patient to brace and breathe. So for flexion, we're gonna tell the patient to take the good arm and lift the affected arm during the concentric phase. So they're taking it into flexion. And then you're gonna tell the patient to remove that arm and slowly lower the weight through the eccentric phase. So it's taking it into extension. Again, take the good arm and bring that affected arm in during the concentric phase, so flexion, and then remove the good arm and slowly lower the weight through the eccentric phase. To do extension, we're gonna do it with palm down. Remember, we're gripping in the middle of the hand weight, and we're gonna tell the patient to take the good arm and bring and lift the arm up during the concentric phase, and then remove the good arm and slowly lower the weight through the eccentric phase, so into flexion. And again, we are helping the affected arm to go into extension, and then we remove the good arm, and then they lower the weight into the eccentric phase, which is going into flexion. To do supination and pronation, the grip is gonna be at the end of the weight, of the hand weight. So we're gonna grip like this. And for this one, so we're gonna do supination first. So for supination, we're gonna tell the patient to take the good arm, remember that they're bracing and breathing. Take the good arm and lift the arm into the concentric phase and stop when the thumb is pointing up. Now right here, they're gonna remove the good arm and the patient has to slowly lower the weight slowly lower the weight through that eccentric phase. So the eccentric phase will be starting at the thumb up and then ending with the palm down. Now to do pronation, we're gonna tell the patient to take the good arm and lift the arm into the concentric phase, so it will be pronation, and stop when the thumb is pointing up. Then they're gonna remove the good arm and then they're gonna slowly lower the weight through the eccentric phase. So the thumb is gonna start pointing up and then it's gonna end with the palm up. So this will be the eccentric phase for pronation. So we will be doing supination. And then remember that they're bracing and breathing at all times. Next is the Tyler twist exercise. This exercise is very helpful to treat patients that come in with lateral epicondylopathy. So for this exercise, we're gonna need a flex bar or a rotary bar, but because I don't have one, we're gonna be using we're gonna pretend that this is the flex bar. This does have like a rubbery feeling, so this will also work. So to do the Tyler twist, we're gonna do it for the right arm. So we're gonna tell the patient to grab the flex bar with the affected arm, just like this. The elbow is gonna be bent, and the flex bar is gonna be sticking out towards the thumb side. And then they're gonna do maximum wrist extension with the affected arm, just like this. And then they're gonna take the other hand and place it at the other end of the flex bar. Now what they're gonna do is that they're gonna bring this arm into flexion, creating tension on my right arm. And you're gonna keep that extension and bring the flex bar to a horizontal position, extending the elbows. And now you're gonna tell the patient to slowly release the tension of the right wrist. So slowly release that wrist extension. And that will be the eccentric phase of the extensor muscles of the wrist. So again, remember that the patient should be bracing and breathing at all times. So again, grab one end, take it into maximum wrist extension, grab the other end with the other arm, take it into flexion, and then bring the flex bar into a horizontal position, elbows straight, keeping that right arm in extension, and then slowly release the tension of the extension of the right wrist, and that will be the eccentric phase. Well, we usually tell the patients to do this with 3 sets of 5. We also can progress this exercise by using less flexible bars. Okay, then the last exercise for the elbow rehab protocol is the reverse Tyler twist exercise. So for this exercise is very helpful when we're treating patients that come in with lateral epicondylopathies. So we're also needing the flex bar for this one. So what we're gonna do is we're also gonna do it for the right arm. So what we're gonna do is we're gonna have the elbow bent, and we're gonna grab the flex bar on one end like this, but this time the flex bar is gonna be sticking out towards the pinky side, just like this. Now we're gonna take, because we're treating the flexors, we're gonna take the wrist and put it into maximum flexion. And then we're gonna take the other hand and grab the other end of the flex bar like this. And then we're gonna twist like this. And then we're gonna tell the patient to bring it into horizontal, extending the elbows. We're not releasing the resistance on the right wrist right now. Then now we're gonna tell the patient to slowly release the resistance or the tension. and bringing that wrist into extension. And then again, so we start right here. We're gonna bring it into flexion. Then we're gonna grab the flex bar with the other hand. We're gonna twist. Then they're gonna extend their elbows. They're bracing and breathing. And then they're gonna slowly release the tension of that wrist flexion. And they're taking it into extension. Everything should be done slow and controlled. And they're gonna do 3 sets of 5. We can also progress this exercise by using less flexible flex bars. So different colors. There's red, yellow, green, different colors. Okay, so this is the end of my presentation about the elbow. Thank you for your attention. I hope you have enjoyed it.